This healthy living tip is brought to you by the Christ Hospital.
Everybody needs a primary care physician. You know, as medical care gets more and more complex, everybody needs one physician who really directs the entirety of their care. Medicine, for better or worse, has become increasingly specialized, and the complexity of care simply requires that one doctor knows everything about your care and coordinates all of that care with the specialist and with really all the healthcare providers that you're going to see. So personally, I really believe that word of mouth is often the best way to find a doctor who's compatible with your particular situation. Obviously, there's no lack of information about doctors in the community. You can go online, you can look at their medical training. Board certification may be important, may be something that you want to pursue. But I think in terms of getting started, word of mouth is always a good way to start. Well, most primary care physicians will ask you to fill out a questionnaire before you come into the office, whether it's on paper or via the internet. It's very important that you bring all of your concerns and that you be organized, especially for the first visit. I think some patients are reticent about bringing a list, writing down their issues, but to be honest, it makes the encounter much more valuable both for the patient and for the physician if you know the issues and you define the issues right up front. So be prepared to talk about your medical history, be prepared to put all of your current issues on the table. It'll really help the primary care physician get a better feel for your overall health and your most urgent health issues. I think as we've built the Christ Hospital Medical Associates, we've been very diligent about picking the right physicians. We have a wonderful mix of established physicians, new physicians. We have geographic coverage around the tri-state area. I think more importantly, we have a group of doctors who are all very committed to provide the very finest primary care services that they can. All of our primary care physicians are available 24/7. Every doctor has, every patient has the ability to page his or her physician at any time, 24/7. If you look at the area that Christ Hospital serves, it's many communities, it's many counties, both in Ohio and in northern Kentucky. And we're pleased particularly that we've opened our first office in northern Kentucky as well. So we really feel that not only can we provide the best specialized services in Mount Auburn, but we also now have a very broad geographic coverage for the outpatient services as well. Well, we're very pleased now to have an urgent care center on Red Bank Expressway, our first effort into that venue. We recognize that people don't always get sick between 8 and 5 Monday through Friday, and they need a venue outside of the emergency room so that they can have their acute care needs taken care of. Around the city, emergency rooms are swelling with patients, many of whom can be served in a much cheaper, more appropriate, and very effective venue such as an urgent care center. So this is our first effort and certainly won't be our last in the community. Internal medicine physicians are only trained to take care of adults. So a typical internal medicine practice would see patients from the age of 18 and higher. Family medicine physicians are trained in a broader manner. They're trained in pediatrics, they're trained in surgery, they're trained in OB-GYN. They don't necessarily practice in all of those particular specialties, but they're capable of, and they do take care of people from newborns all the way through adult life. So the main difference is really the focus on adult medicine and internal medicine, and if you will, the entire family and the entire spectrum in family medicine. So I think in every office there's an informal system where the doctors can consult each other, if you will. It's not unusual in my office for any of us to bring one of our colleagues into the room, or certainly to discuss a case that might be difficult or challenging. We're also supported, of course, by excellent support staff, medical assistants, registered nurses. We really feel that the team effort, the cooperation among all the team efforts adds to the total quality of the patient experience. Endocrinology is really a subspecialty of internal medicine. Endocrinologists focus specifically on diseases that have to do with the glandular system, primarily diabetes and thyroid disorders. Those would be the two areas that most patients are most familiar with and the two most common disease types that endocrinologists care for. The reason they're part of our primary care group is that in many ways they provide the primary care for patients with diabetes and with thyroid disorders and other endocrine disorders. So particularly with the explosion of diabetes in the United States, we really feel that a group of very well-trained and highly qualified endocrinologists is a tremendous asset, both to the community and to those of us who have access to them as specialty physicians. Geriatrics is really one of the most exciting developments I feel that our group has taken on in the last few years. Everybody's aware of the population aging, the incredible need for physicians and team members to take care of these very frail, very complicated adult patients. About a year ago, we opened a geriatric assessment center. It is unique in the community. It is the only geriatric center in the community that can provide both consultation but also ongoing continuity care for the most fragile, for the most difficult and complicated patients in our practices. So this is not only a tremendous asset to our medical group to have access to these geriatricians, but to the community as a whole, because it truly offers a unique venue of care for those patients. Christ Hospital truly wants to serve the community in the best way that we can. And that philosophy really does flow from the board of directors, through the administration, through the nursing staff, all the ancillary staff and the physicians. It truly is a culture of excellence that we've created here. And we want to spread that throughout the community to the fullest extent that we can.
To locate an office or physician near you, call 585-1000 or visit thechristhospital.com/TCHMA.